This scenario is an average 38-year-old woman at RSC using her own eggs. So we saw from the graph before an average 14 eggs retrieved. So about 80% of those eggs are going to be mature. So if you think back to the slides earlier, some eggs mature, some immature.
Right.
So that on average give her about 11 mature eggs. We do ICSI. And our fertilization rate in our clinic is quite high, about 80%. So we would expect to see 9 embryos there. About 50% of those embryos are going to make it to the blastocyst stage, which we saw the slide of the blastocyst embryos. So that's about 4 or 5. The other ones just stall out. They stop developing. And we know from studies in the past that most of the embryos that stop dividing are aneuploid. Most of them are chromosomally abnormal and would never have resulted in a baby anyway.
Okay.
So if we're doing PGT and we have these 4 or 5 embryos in a 38-year-old, in our center, 46% of those embryos will be chromosomally normal. So that gives you 2 chromosomally normal embryos. More than 85% of the time we transfer 1 embryo in our clinic, regardless of the patient age, and we can talk about that data a little bit later if we have time. 61% pregnancy rate and 57% live birth rate. This data is from 2016. It's actually a little bit higher now. In fact, I have it right here. The live birth rate now is 67%.
All right, so like 10% raised 10%.
Right.
Okay.
So if the patient does not get pregnant on the first 2 transfers, by the 3rd transfer, our data show she has a 92% chance of getting pregnant.
I see.
But you can see from this, if she only has 2 embryos from the cycle, she may have to go through more than 1 cycle.
I see.
So there is attrition at every step along the way. So that question was a really good one. It's important to know.
从取卵到最后移植，这个数字是怎么来体现的？就是这个是一个我们医院的一个真实案例，38岁的妇女用自己的卵子取了14个卵子出来，在我们的医生的出牌方案之下，11个成熟的率嘛，那就是80%。下来就是说，成熟之后这个胚胎有9个胚胎也是80%，这个我们的 lab 是很高的。然后到第囊胚期，大概是一个50%的，就是4到5个胚胎到第5、第6天。经过染色体筛查 PGT 筛查，有2个，那基本上46%，接近50%，所以这时候你就会有2个胚胎。如果这个38岁的妇女14个卵子取出来的话，经过染色体的筛查，会有2个健康的胚胎。所以这个是移植。那移植的成功率呢？这个下面会有，这个是比较老的，16年的，我们 post 在 CDC 上面的。现在的成功率，一个就是活胎率是已经到了67，这个是57，现在的刚才 Dr. Iwan 你给我看是67，所以呢，如果他只有2个胚胎的话，他想达到90%的几率呢，可能再来取一次卵。如果两个胚胎的话，我想可能这个就是大概80%、70%的成功率吧，我想活胎率。